Stephanie Bell-Flint joins us now, and today we're talking about shoulder surgery. And if you have questions, you can send them to the doctors at WLBT.net.
Joining us today is Dr. Rhett Hobgood with Mississippi Sports Medicine. And thank you for joining us, Dr. Hobgood. But one thing that we want to know is about a new procedure in particular, and it's called a reverse
shoulder replacement. That's correct. And this is a model that gives you an idea of what that is. And the reason it's called the reverse is because normally our ball sits on the top of our humerus at the shoulder, and the socket is more of a concave socket that makes a ball and socket joint. But we've reversed that. You can see that on the socket of the shoulder blade we've placed the ball, and on the top of the humerus we have the socket. That makes a reverse ball and socket joint. And the reason that is important is because sometimes the shoulder degenerates because of a chronic massive rotator cuff tear, and we don't have the ability to keep the arm or the shoulder in socket when we raise the arm up. And this provides an environment that allows the outer layer of the shoulder, the deltoid muscle, to raise the arm up around this reverse ball and socket joint.
That is amazing. Now, who is a good candidate for this type of surgery?
Well, this is not the answer for every rotator cuff tear. Certainly we have less invasive techniques of arthroscopic rotator cuff repair, but this is more for your patient in the later years of life that have severe degeneration of the shoulder joint because of a large chronic rotator cuff tear. It's ideally a lower demand patient that's in the 65 to 70-year-old range that really has poor function. In other words, they can't raise their arm up to even take care of their hair, and they have a significant amount of pain.
How do you tear your rotator cuff?
It can be acute from a fall. That's one common way to injure your rotator cuff and tear the rotator cuff, but it's often a chronic degenerative thing that happens over years. With overhead activities, we have bony prominences on top of the rotator cuff, spurs that we can sometimes take away, but those things can cause a chronic degenerative tear of the rotator cuff that can happen just with going through the years of life. So.
Because it seems like you hear more about it with sports injuries. Obviously, you're talking about an older patient demographic here, but that's where you hear most of it from is pitchers.
Well, you do hear a lot in the news about your pitchers, your baseball players with the rotator cuff problems, but in just the general population, certainly one of the most common diagnoses that we see as shoulder surgeons is rotator cuff pathology.
Well, when you have a normal, can't you do a normal shoulder replacement?
Sure, that is for just a routine osteoarthritis of the shoulder, and this is some x-rays of one of my patients that has osteoarthritis of the shoulder, and you can see that on the left here with loss of joint space between the ball and the socket, and so there is a normal space for the rotator cuff. However, as you see, we have replaced that on the right here, and the patient now has a new ball, a new socket, and a joint space that prevents the pain from the osteoarthritis. This situation, however, does not work when the shoulder has degenerated from a rotator cuff tear. And you can see the difference here in this shoulder where the rotator cuff is completely gone and the ball has migrated up against the acromion, and we're starting to get degeneration because of that massive rotator cuff tear. On the right, you can see where the reverse replacement has been done, which lowers the humerus and puts it under that ball, and that allows for a functional or biomechanical advantage where the outer layer, the deltoid muscle, can raise the arm up.
Now, when you look at that, it looks like the whole arm could be affected if you don't treat this. Is that true?
Well, it's the shoulder joint that's affected. They have pain that radiates down the arm. It's certainly with this type of problem, it prevents them from getting their arm up above the horizontal. They can't do activities of daily living just as such to take care of themselves.
Wow. Very good. It's amazing.
Well, you know, the thing is, I'm sure with this too, you could have a lot of muscle atrophy.
Certainly.
And stuff like that. So rehab's probably very important here.
Rehab is important. We want to basically have a patient-directed program where the patient is supervised by a therapist. We don't want to have a lot of passive manipulation, but we work on the muscles that are surrounding the shoulder, the deltoid, the muscles that are holding the implant together and strengthening those. And it generally is about a 2.5 to 3 month process to get over the operation.
Dr. Rhett Hobgood with Mississippi Sports Medicine, thank you so much for joining us. We appreciate it. And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.